Hello, this is David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is what you need to know about whiplash. Whiplash involves a hyperextension and flexion injury to the neck, and it's when one's head suddenly moves backward and then forward due to a sudden shift in direction. The extreme motions push the neck muscles and ligaments beyond their normal range of motion, causing injury. So why does it occur? It's most commonly from a rear-end automobile accident, motor vehicle accidents, otherwise like a T-bone or something, sports injuries, possibly an amusement park ride, a slip, a trip, or a fall, and then an assault. There are over 3 million cases per year in the U.S. It occurs more often in women than men, and it's theorized to be due to the differences in the anatomy of male versus female necks. What are the symptoms? Well, it may include neck pain, stiffness, spasms, headaches or dizziness, blurred vision, fatigue, memory problems, irritability, and possibly a difficulty with concentration and sleeping. So the reasons for whiplash, it's unclear. It appears that there is ligament damage in the front and the back of the spine, and also due to damage to the facet joints of the neck, the small little thumbnail-sized joints that contain cartilage just like other joints that are mobile in the body. This can lead to post-traumatic arthritis and chronic neck pain in 15 to 20% of those who experience whiplash. So treatments for whiplash on the medication side may include anti-inflammatories or Tylenol, which are over the counter, opiates and muscle relaxers, which are obviously prescription, bracing, physical therapy, chiropractic, acupuncture has been shown to be extremely beneficial, spinal decompression therapy, which involves intermittent computerized traction, and then there are the interventional treatment options, which may include trigger point injections, facet blocks, medial branch blocks, and then possibly a radiofrequency ablation. The facet injection, which you see here, is when the needle goes actually into the facet joint, and numbing medicine and steroid medicine are placed into that joint, just like you would a knee or a hip joint, and that can provide pain relief for weeks to months. Okay? Trigger point injections involve the needle going in way back here, just in the muscle space, and that can help a lot with decreasing spasms. So this is an example of a radiofrequency ablation. So if you do a facet injection, the needle goes into the joint. You know, this is actually a lumbar spine, so just pretend it's a neck, okay? So these little nerve endings right here, if you do a medial branch block, that's what these are, the medial branches. So that can deaden pain going to a neck joint. And if that works and wears off, this treatment, the radiofrequency ablation, can deaden those for up to 18 months, 24 months. So it can be extremely beneficial for long-term pain relief and prevention of chronic whiplash pain. So typically the prognosis is very good with non-operative whiplash treatment. Head and neck pain typically resolves within 3 months. If it does become chronic, which usually occurs in 15% of the time, non-operative treatments can lessen that number, so it can be a much lower percentage than 15% and obtain pain relief earlier. The top non-operative pain management in the greater Chicagoland area is with Premier Pain Specialists. There are several clinics throughout Chicago, in and out. Over 50 insurances are accepted, and over 25 treatment options are provided for whiplash and all other types of acute and chronic pain conditions. Call us today at 847-220-7907 and visit us online at ppschicago.com. Thank you very much for watching.